Hi, everyone, and welcome to Morton College's Contact Tracer Program, Module 1, Topic 2 of testing. In this topic, we are going to talk about how COVID-19 is diagnosed, understand the different types of tests associated with COVID-19, and also understand the purpose of testing. The first group of tests we're going to talk about are viral tests. Now, viral tests are good for the moment you are getting tested and only that moment. They're used to tell if you have a current infection. So, do you currently have the virus that causes COVID-19? The respiratory sample is most commonly taken from a nasal swab. And there's two types of tests here. We have nucleic acid amplification, also known as a molecular test, and also an antigen test that can be administered. Depending on the facility you go to, they're going to have one of these two types of tests. Now, something unique about these two tests is that they actually can be administered as a point of care test, meaning you get the results right there on the spot. They also could be sent out as well to a lab, and then the facility gets the results in like 1 to 2 days later. But you can, with a point of care test, you would want to use this if, say, you're in a hospital and you need to know the results right away, or there's a long-term care facility breakout, or maybe a work breakout, and you need to know what workers currently have the virus so they can't be in that workplace with others. So there's some benefits of these two tests that you can possibly get really quick results. Now, the molecular test takes about 5 to 30 minutes once the swab has been swabbed. And the antigen test takes about minutes. You can get that within minutes. The antigen test is different because it's testing for a protein in the virus that causes COVID-19. And sometimes what happens with the antigen tests is they're not as accurate as the molecular tests. So, for example, if the facility is using an antigen test, you get a test, and if you get a positive result back, then yes, you have COVID. But if you get a negative result back, there's a possibility that you might have COVID because there's a lot of false negative reports with this antigen test when the antigen test is delivered as a point of care test. So you just kind of got to watch out. Your doctor or your healthcare provider will definitely lead you in the right direction if you get these tests. Because sometimes with the antigen test, if it comes back negative, they might recommend going somewhere where you can get the molecular test since they're more accurate. The next group of tests we're going to talk about are antibody tests. Now, currently, the CDC does not recommend antibody tests to be administered to test for current acute infection. The reason for this is because it could take about 1 to 3 weeks for an individual's body to build up the antibodies post-infection. So these tests are only recommended to detect past infection at this time. And that's even if the person was asymptomatic. These are different from viral tests in that the sample is taken from the person's blood to see if they have the antibodies from the virus that causes COVID-19. Another name for these tests are serological tests. So you might see antibody or serological. But the important thing here is that this is past infection, and you use a sample of a person's blood to actually test for the antibodies. So this test is actually used for this multi-system inflammatory syndrome in children that's kind of being more apparent right now. We don't know a lot about it right now. But it's when different parts of a child's body can become inflamed. And this happens after they would be exposed to the virus. So maybe they had it, or maybe they were exposed to someone with it, and they developed these inflammation in different parts of their bodies. It's all very highly unknown right now. So if you see in the pictures here, it could be in the hands. You might see redness in the feet, on the back. The child's tongue is very, very red, swollen. Different parts are swollen. So there's not a lot we know about it right now, but it's the antibody test that they give children to see if they had the antibodies, to see if they had the infection. That's why they have this inflammation going on. So moving forward here, why we test? Why do we test? Well, one reason why we perform tests is because an individual has signs or symptoms, right? So they have the symptoms of the virus, so we want to test them to see if they have it. We covered those symptoms in topic 1, but some of those are the shortness of breath, the coughing, the fever, many others, but that's one reason why we test individuals. Another reason why we test is that someone could be asymptomatic but might have had a recent exposure to the virus, and we want to make sure we're controlling this. This is done with the viral test. By the way, all 5 of these are done with our viral test, not antibody test, viral tests. And it's recommended for all close contacts. And the main reason for this is to control the outbreak of this disease. And then one other reason why we test is asymptomatic individuals, and they might not even have known or suspected exposure, but they might be living in one of those special settings that we'll get into later. This would be done with the viral tests, and those special settings are long-term care facilities, homeless shelters, congregate worker living settings, anywhere where you have those high-risk situations where this virus can spread rapidly. Prison. So you might get tested even though you have no symptoms and you have no exposure, just to be safe in these settings. Now this next one, this actually has recently been changed. In the beginning, we were testing to determine resolution of infection. So what that means is we're going to test someone after they've had the infection for 14 days to see if they still have it. However, the CDC just came out with a recommendation that testing is no longer recommended to discontinue precautions on someone. So this is only if the patient is suspected to have an illness for greater than 20 days. They're still having symptoms. They're sick for a long time. Then you might do this. But now the new recommendation is symptom based. So if you're severely ill or severely immunocompromised, 20 days after your symptom onset is when you're technically okay to be, say, out in the world. Or if you were asymptomatic, 20 days after a positive COVID test to discontinue your isolation or quarantine. So testing is no longer recommended to discontinue isolation into the free world. It's more based on symptoms, and we'll get into that a little bit more later in further topics. And then the last reason why we test is simply for public health surveillance. We want to determine where those hot spots are. Where is this virus circulating? Why is it? Determine trends in the disease by location. Who's getting this? What are our age groups? There's a lot of talk about that right now in the news. Also, we want to provide insight into the impact of disease over time. As we develop and get more information, we get unfortunately more numbers going up around the world and seeing where the virus is hitting hardest, so to speak. And just some testing facts, we talked about a few of these already. The point of care tests are possible for those viral tests. You can do it on site and you can get the results within an hour. The lab tests, you get them in about 1 to 2 days for the results if they get sent out. One thing we didn't mention is that it's not recommended to test the same person within 24 hours. So if you get a COVID negative test and you need, say, 2 of them to go back to work, that's what your work says, you need to wait 24 hours and then go ahead and get another test. So no testing within 24 hours for the same individual. And the serological tests, they test for post-infection, and it's not really clear yet. We don't know if that means immunity. So there's a lot up in the air right now. There's no evidence that if you have the antibodies that you actually have immunity to the virus from getting it again. There are some individuals that have been reported to get the virus again, even though they already had it, and some people don't. So it's just kind of something we're still learning at this point. Here are the websites where all this information was taken from for this topic. Again, everything's coming from the CDC. The CDC is constantly updating, so if you're interested in any of these topics, go ahead and visit these sites. And I will see you in the next topic.